Ciao mundo, hello world, hola mundo, hello mon, mabuhay mundo. We are here in the Philippines, in Manila, at the National Philippine Nephrology Society meeting, and I'm spending some time with Professor Radhakrishnan from the Columbia University in New York, who presented a fantastic lecture on diabetic nephropathy. So Jai, what is new in diabetic nephropathy?
Well, the first thing, Claudio, is that we don't call it diabetic nephropathy anymore. We call it diabetic kidney disease. Because it's not just diabetes that causes kidney damage. There's a whole host of other etiologies that can cause kidney problems in patients with diabetes. And I can tell you a little bit about our biopsy series. We compiled about 600 biopsy patients with diabetes, and about 1/3 of them had diabetes and 2/3 had other etiologies. And it turns out that ATN is a very common cause for decline in kidney function in patients who have existing diabetes and a rapid progression of kidney failure.
So that is susceptibility of the kidney, probably?
I think
exposures?
That is correct. I think we are being very aggressive with blood pressure control and a use of ACE and sometimes ACE and ARB. And patients with diabetic kidney disease have diabetic vascular disease, and they're much more susceptible to insults, especially hemodynamic insults. And we are seeing patients, especially older patients, on high doses of ACE and ARBs and diuretics who come in with AKI because of this reason.
You showed some new interesting drugs. Anyone in your mind that can modify a little bit the history of these patients?
Correct. I think the most exciting group of drugs are the SGLT2 inhibitors, and they block the glucose sodium co-transport in the kidney. And it turns out that there was a recent trial looking at cardiovascular endpoints, and it seems to be a reduction using these drugs. Now, how exactly this happens is not clear, but these drugs do reduce weight, and they have an intrinsic natriuretic effect, so blood pressure is also well controlled on these drugs. But very importantly, by restoring back the tubular-glomerular feedback in patients with diabetes who've lost this because of ongoing glycosuria and natriuresis, these drugs actually cause the restoration of the tubular-glomerular feedback and consequently reduces hyperfiltration and albuminuria as well. So we are hoping that this may modify the disease course of diabetic nephropathy.
So that's interesting. And would you like to close telling a little bit about the new journal that you're going to be editor-in-chief?
Yeah, thank you, Claudio. That's a project very dear to my heart. And Kidney International, as you know, is a flagship journal of the International Society of Nephrology. And over the last 10 years that I've been an associate editor, we had to turn down a lot of very, very nice, very well-designed trials simply because of space. The new journal is an open access, online-only journal, and we'd love to have our nephrology community take advantage of this. So knowledge dissemination is not restricted with a society membership or a library, a paid subscription. So everyone can access these articles for free.
Okay, and the name of the journal will be?
It'll be Kidney International Reports, so it's a spin-off.
So with this, thank you very much for joining today Cappuccino from Manila, and have a wonderful day. Excellent.
Beautiful.